All right. The World Health Organization has issued a stark new warning about global readiness for the so-called disease X, a term for the next hypothetical deadly pandemic that's going to hit us someday, maybe.
The next pandemic is a matter of when, not if. And as things stand, the world remains unprepared for the next disease X and the next pandemic.
Here with Reaction, Fox News medical contributor, Dr. Marc Siegel. Dr. Marc, good morning to you.
Hi, Steve.
We weren't ready for COVID. Why should we be ready for this thing?
Well, we're not, but the other issue is that the World Health Organization loves to scare people, and they've been saying it's not a matter of when, not if, for decades now. In 2018, they coined the term disease X, meaning the disease that's coming next, that could get us all next. And by the way, it could spread more than COVID. It could be more deadly than COVID. That's a given, especially with all the labs around the world that are doing gain-of-function research, which are testing virus potential, and the viruses could slip out of the lab. But what he's talking about that I think is really serious here is the issue of preparation. And Steve, with COVID, it took months before they figured out that it was airborne. So a lot of the lockdowns and these extended strategies did more harm than good because the virus spread anyway. What we need is a strategy looking forward, looking down the line, controlling all of this research going on in the lab or having a moratorium on it. And preparation means rapid testing, vaccines that would fit almost any pathogen, and having the response suit the virus that comes out. That's key. The World Health Organization, one more thing, with COVID, actually didn't warn us. They said it was a regional problem only in early 2020.
Unfortunately, since COVID now, a lot of people are afraid of vaccines, so let's see how that goes.
No, that's another great point.
I know. Meanwhile, let's talk a little bit about something. There are a lot of communities that have hospitals that are in danger of closing, and we're talking about rural hospitals. There's a new study that came out in some of the states with the most vulnerable to closures are Texas, Kansas, Nebraska, Oklahoma, North Carolina, Georgia, and Mississippi. Those states right there. I have a loved one who went to a hospital in Kansas with a really serious condition. There was no doctor there. They scanned him. They shot the scan out to somebody. I think they read it in maybe Tennessee and said, you got a problem. And this is a problem for a lot of people in those states.
In the South, in the Midwest, in Texas and Kansas being top of the list. You're from Kansas. You know this very, very well. The problem is how expensive everything is. Maternity care, cancer care, end-of-life care. We spend a fortune on that. And 40% of our rural hospitals are losing money because of it. And there's burnout, staffing problems like you just mentioned, people quitting because of the pandemic. What's the solution? Increased telehealth is helping. That's one solution. Artificial intelligence is going to help. Believe it or not, I'm a huge fan of artificial intelligence. Cuts down on paperwork, should cut down on costs. That plus telehealth and figuring out a way to reinvigorate the medical and nursing professions. We have to do it because we love it. That's got to be number one. It can't be all the paperwork and the administrative work.
You know, you see the sign, hospital that way. You would think there would be a doctor in there. Not the case in some instances.
That's not only out there. It's also in New York, unfortunately, but especially in rural areas. Huge, huge problem. A shout out to nurse practitioners, though, and physician's assistants.
Absolutely.
They are helping to fill the void.
They are picking up the slack. Dr. Siegel, thank you very much
Great
for Medical Monday. I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.